Well, in just about a month's time, the COVID pandemic reignited, thanks to the Delta variant. And more than a year into the pandemic, millions have immunity from either getting the virus or getting the vaccine. But is one better than the other? Let's check in with Michael Tater.
To me, it's incredibly frustrating that there's any question about whether or not to get the vaccine.
Dr. Jennifer Hanrahan, Chief of Infectious Diseases for the University of Toledo's College of Medicine, says the latest wave of the pandemic is, in her eyes, the most dangerous. She says people coming into ProMedica's Toledo Hospital with COVID are more sick than last year.
Those people who needed a little bit of oxygen are not, we're not seeing that anymore. People are coming in needing a lot of oxygen. So that's the main difference.
To date, around 50% of the U.S. is now fully vaccinated, but there are also many people who didn't get the shot who have natural immunity from getting the virus. However, there's a new CDC study that shows more protection if you get a vaccine.
There is data to show us that people have more immunity when they get the vaccine than they do from having had previous infection, especially if it was mild or moderate.
The Moderna and Pfizer mRNA vaccines have proven to hold up best against the many variants and help to reduce spread. Dr. Hanrahan says in her 30 years of practicing medicine, COVID-19 is the worst disease she's ever seen.
It's unpredictable, it causes an immense amount of suffering, and it's preventable. So why would you allow anyone to go through suffering that's needless?
She urges everyone to get vaccinated, especially those who are still on the fence. In Toledo, Michael Tater, WTOL 11.
And the doctor points out that the CDC says whether you test positive or negative for COVID-19 antibodies, you still should take steps, including getting vaccinated, to protect yourself and others.